Unit 21.2 Age and Sport. Introduction. Sport is considered by many in social society to be for the young. Children start football at little kickers at 2 years old, and Olympic gymnasts peak in their late teens, early 20s. Professional athletes are often finished by the time they reach their late 30s. There are stereotypes for aging in sport, as people who below the age of 30 tend to play sports like basketball, football, rugby, which are generally fast-paced and intense games, whereas people who are older tend to play sports like golf, snooker, chess, and cricket, which have less pace and more concentration. So, is there a place in sport in those over 40? Do over 40s have to take part in secondary sports? Aging. Aging is the process of becoming older. In humans, aging represents the accumulation of changes in human beings over time, encompassing physical, psychological, and social changes. We have an aging population. The number of people aged 60 or over is expected to pass the 20 million mark by 2030. Our research shows that as you get older, you're far more likely to be inactive and do less than 30 minutes of physical activity a week, stated Sport England. Chronological aging is the time human has been alive for. This cannot change. Biological is how old the person appears to be. There are many factors which go into biological aging, like health factors, loss of cells as you get older, organs becoming more inefficient, slower repair of tissues and injuries, lower immunity, and less flexibility. Other factors affecting biological aging are smoking too much, having a poor diet, your stress levels, alcohol consumption, and not having enough sleep. There are two types of biological aging, which are social aging, which is the changes of expectations and roles of people as they become more mature, and physiological aging is changing in learning, memory, intelligence, altitude, tolerance, and personally coping. Skeletal system. When you get older, so about 30 to 40 years old, your skeleton and your bone density starts to decrease due to the osteoblasts. There is a decrease in osteoblasts, which are cells that lay down minerals and start remodeling bones, whereas the osteoclasts remain, which are the cells that remove damaged bone cells, which means the bone size decreases. Your skeleton also decreases in size as the cartilage in your joints get thinner. This also means joints become more painful. Your size starts to decrease. You also get a decrease in resistance and increase in the rate of damage. When your cartilage gets thinner, your joints also stiffen, which means you should start to do swimming, which is not weight bearing, so doesn't exert more impact and pressure on your joints. It will also increase the synovial fluid, which helps to lubricate the joints, helping to make it less stiff. The bone's density also decreases as you get older due to the bones becoming more brittle. Bones are easier to break, and when they take longer to heal due to being more brittle. Osteoarthritis can cause pain and inflammation in the joints, which is more common after 40. Some ways to prevent this effect is by increasing your calcium intake in your diet to strengthen bones, and regulate exercise. For example, light jogging or walking basketball will help as it is low intensity and doesn't cause further damage. Also importantly, osteoblast activity increases with exercise. So the more exercise you do, the stronger your bones become. Swimming is another recommended way to help as it increases your synovial fluid, making your joints less stiff. Another prevention would be to have surgery to replace your cartilage. The endocrine system. The endocrine system is a messenger system which controls the hormones which maintains homeostasis in your body. Aging negatively affects hormones secretion by the glands of the endocrine system. This makes older people more prone to insomnia, fractures, diabetes, and cognitive changes. What happens with aging? Your hormones are receptors decrease with sensitivity and lose effectiveness with age. The four hormones which decrease with age are oste- estrogen in women, testosterone in men, growth hormones, and melatonin. A decrease in estrogen for women leads to the menopause, which leads to brittle bones and osteoporosis. Thus, in men, testosterone levels usually decreases generally, but means there will be a decrease in the efficiency of male reproductive system, leading to a decrease in confidence and a demotivator to do more sport. A decrease in growth hormones will lead to decrease in muscle mass and strength, and as a result, there will be a decrease in melatonin. This means that you will get a weird sleeping pattern and will start to feel tired all the time as a result of the decrease in melatonin. Decreased levels of growth hormone may lead to decreased muscle mass and strength. Decreased melatonin levels may play an important role in the loss of normal sleep-wake cycles with aging. The reduction of growth hormone levels have an effect on the person's ability to exercise. They are often experiencing a reduction in confidence, so are more self-conscious and anxious to undertaking training they cannot do well. Poor sleep patterns will affect their energy levels, making them feel more fatigued and less able to train. Muscular system. You start to lose muscle mass at 45 years old. This is due to when you get older, the signals from when you eat protein start to become more resistant to the signals, which means it doesn't build muscles as fast. Mitchell et al. Stated that at the age of 70, men lose 4.7% of their muscles, and women lose 3.7% of their muscles. Men lose more muscle due to having more muscle. As there is a lower amount of protein in older people, their muscles are tendons take much longer to repair, meaning older people are more likely to get injured and more chance of it being serious. Muscle tissue replacement is slower, so if injured, the length of recovery time from injury is also longer, which means a longer time to inactivity and the reduction of muscle mass. There is 50% age-related muscle damage caused by the disuse of muscles. This leads to a decrease in mobility, which leads to decrease in flexibility. To prevent muscle injuries at an older age, you can do more regular light exercise like walking pets, walking to the shops, swimming, walking football. Sport massages are also a benefit. To improve flexibility, yoga and Pilates help to regularly use muscles and promote more movement in joints. Flexibility exercises such as yoga are great if your joints tend to be stiff. Yoga exercises help to manage the effects of osteoarthritis too. Cardiovascular system. As your body ages, your heart loses elasticity. As you age, your max heart rate will go down 1 beat every 1 minute. Therefore, you will not be able to work as hard as you were when you were 20. The muscles of the left ventricle get thicker, and the volume of the left ventricle may decline as a result. The heart fills and empties more slowly. Your stroke volume decreases as your heart is able to take in less blood in every contraction, and cardiac volume pumps less blood around the body. The increase in the heart rate and cardiac output is a response to physical activity is also less, and the maximal heart rate declines. Capillary walls get thicker, so gaseous exchange is less efficient. Again, lower the body's ability to supply oxygen to the working muscles as quickly. Blood volume decreases as quick. The blood cell production is lowered, so less blood cells means there is a less myoglobin carrying oxygen around the body, meaning the aerobic capacity gets weaker. Common problems are angina, which are pains in the chest due to inadequate blood supply to the heart. Heart problems increase. Arthrosis is a potentially serious condition. It's when arteries become clotted with fatty substances called substance called praquis or atheroma. High blood pressure increases as you age due to the baron receptors becoming less sensitive. This puts extra strain on your heart and blood vessels. This may increase your risk of heart attack, heart failure, stroke, and other conditions including kidney diseases and dementia. Venous valves deteriorated, which then leads to pooling of blood in the legs. How to prevent it? Have a healthy diet and restrict too many fatty foods in your diet. Don't smoke and take regular light exercise, aerobic exercise. Respiratory system. The lungs mature by ages 20 to 25 years, and thereafter aging is associated with progressive decline in lung function and decreased airflow. Clearance. Respiratory muscles get weaker with age, so it's hard